With so many people worrying about their physical health, it can be hard to forget to say that you have to stay mentally healthy as well. And so today we are talking to Dr. Jenna Mendelsohn, a licensed clinical psychologist with LeBauer Healthcare, and Dr. David Jordan, the Chief Medical Officer at Alamance Regional Medical Center. He'll be handling your health-related questions. I'm going to start off with you, Dr. Jordan. This person asks a question: what if you have a mask on and you need to sneeze? Should you take the mask down to sneeze in your arm or your elbow, or should you sneeze with your mask on?
The short answer is to sneeze with your mask on in your elbow.
So both, sneeze with it on and with your elbow. Tell me why.
Well, if you take your mask off, you've defeated the purpose. You've been wearing the mask all day. And if you are just sneeze into your elbow, you defeat any purpose that the mask has as well in terms of capturing the droplets that come out when we sneeze.
Okay, so do we need to remove the mask if possible and put on a new mask, or can we hang out with that mask for the rest of the day if that's the one we have?
Well, unless the mask is clearly wet, you can certainly hang on to that mask. Even a wet mask is better than none in terms of controlling the droplet spread when you sneeze or talk loudly.
Okay. All right, Dr. Mendelsohn, this person says, last year my kids were stir crazy doing work from home, and it made them very moody. Any recommendations on what we can do to try and reduce the mood swings since they're going to be home for the start of the school year?
Sure, I've got a few recommendations for that. First of all, it can be helpful to make sure that they're getting exercise so that, while it's nice outside, that they're getting outside, getting a chance to move around so that they're not sitting in front of a computer all day. Also, while they're doing schoolwork, making sure that they have, frequent short breaks, chances to get up and down and, kind of clear their minds a little bit, just like they would have walking between classes at school. It could also be a good time to teach your kids some simple mindfulness strategies, like helping to ground themselves in the moment. One question that you can easily ask them is just to notice 5 things that they hear, 5 things that they see, and 5 things that they can touch. And that can just help ground them in the present moment when they're feeling upset.
Gotcha. It takes their focus off of what they're thinking at the moment and lets them see something else and maybe go on to something else.
Exactly.
Okay. We have another mask question, Dr. Jordan. I haven't used cloth masks, only the paper ones. I constantly change them out and use new ones, but should I get cloth masks instead?
I would not recommend that you go to the cloth mask, although a cloth mask is better than nothing. The paper masks have generally been found to be more effective in capturing the virus particles in the droplets that come out. But certainly a cloth mask is better than no mask. The cloth mask can often be made with only one layer of fabric. The more layers, of course, the better filtration, but the hotter the mask is, and also the harder it is to breathe at times. So if you can get the paper mask, I'd say that would be your best choice.
Okay, gotcha. Dr. Mendelsohn, this person says, I find myself worrying a lot about the virus and now thinking there's always something wrong with me. Is this normal? Do I need therapy?
Well, yes, it's normal right now. And yes, sure, you may benefit from therapy. I think this is a really stressful time, and something that's particularly challenging about this situation is that we might all need to be a little bit anxious about this virus. We really do need to be taking precautions and washing our hands and wearing masks. That being said, if you find that you're unable to stop thinking about it or having difficulty relaxing, even when you're safe in your house and have nothing immediately present to worry about, that could be a good time to seek out therapy.
And it's not a bad thing to go to therapy.
Absolutely not.
Oh, it's a good thing. Get it all out. Okay. Doctor, let's see, I'm looking here on my text here. Dr. Jordan, this person says, if you had COVID-19, can you get it again?
That's a great question. And the answer is not clearly known. We have had cases of people who have tested positive and have had illness and have seemed to have improved, and their test turned negative, and then only to have the symptoms return and to be tested again and found to be positive. The question is At this point, we don't know for sure that it is the original virus that they never completely cleared or if it's a new infection. So the jury is still out in terms of definitive answer to that question.
Okay, this is a follow-up. When should a person feel the need to be tested for COVID? Is it after they've been around someone who tested positive? And what is the time frame of exposure?
Well, there are a couple of points to be made here with this question. If one is symptomatic with the typical symptoms that we've heard of, sore throat, runny nose, cough, and especially shortness of breath, and more and more we're seeing this loss of taste and smell, which is a fairly sudden onset and is fairly unusual for any of us to experience. They should certainly seek care with their healthcare provider or with a clinic or emergency department. The actual exposure, though, to someone with a known positive test is a little trickier. We tend to think that symptoms will begin after exposure in the first 3 to 5 days, but in any individual that can be sooner or later when they could turn positive. It is not unreasonable if testing is available to you and you know that you have been exposed to a COVID positive patient for you to seek testing in the community.
And quarantine yourself until you get that test and after until you get the results.
Well, that's right, because you really, to get the benefit of, or to benefit your family and friends from the fact that you've gotten tested, you need to quarantine yourself as much as possible. Certainly wear a mask and avoid exposure to family members that you know are susceptible.
Okay, we have like less than a minute left, so we're going to take a quick break so that we can get some more of your text questions in. When we come back, we're going to talk about how kids can be affected if they don't see their friends every day. And we're also going to talk about whether COVID-19 can be flushed out of the nose using irrigation. If you want your question answered, you can see the number right down there, 336-379-5775. We'll be right back.